44 adrenal obstruction and gynecology and breast. Question number 1 post RFA syndrome due to frequency of ablation syndrome. The single best answer is hemorrhage, the most common major complication post radio frequency ablation syndrome. Hemorrhage is the most common complication. Question number 2 which favor chronic rather than acute subacute torsion of the spermatic cord? Hypochondriac small and harder testes. Hypochondriac small and harder testes are chronic torsion. Question number 3 second best answer regarding oncocytosis. The multifocality, bilateralism, and metochondrial tumors occur together in 4 to 6%. In oncocytosis, multifocality, bilateralism, multifocal, bilateral, and metochondrial tumor occurs together in 4 to 6%. Question number 4. Infiltrating papillary transversal choroidoma is diagnosed. What is single best answer? B. Have a broad base and frond-like morphology. Infiltrating papillary transversal choroidoma have a broad base and frond-like morphology. Question number 5. Which favors diagnosis of infiltrating papillary transversal choroidoma rather than vitreal endometriosis located in proximal third of ureter? Infiltrating papillary transversal choroidoma located in proximal third of ureter. Question number 6. Regarding York-Stack tumors of ovary, carry poor prognosis than any other ovarian germ cell tumor. York-Stack tumor, poor prognosis. Question number 7. Man with elevated PSA and lesion 4 plus T tumor. A man with a posterior single best answer. Tumor of the gland is low on signal on T2. Elevated PSA, tumor of posterior gland, low signal on T2. Question number 8. Which of the following increased indicates T3 disease in the bladder cancer? Variant of physical fat is T3 disease. Question number 9. Women with serious and bilateral multiple angiomyolomas. Which is single best answer? They are associated with tuberous sclerosis. Seizures and angiomyolipoma associated with tuberous sclerosis. Question number 10. Granulosa cell ovarian tumor is diagnosed. Following tumor over complex pelvic mass. Single best answer. Variable imaging appearances are recognized from unilocular cystic masses to solid masses. And granulosa cell ovarian tumor. What do you see? Variable imaging appearances are recognized from unilocular cystic masses to solid masses. Granulosa cell varies. Question 11. Which is the cause of dilated calyx with white infundibuli? Structure secondary to calculus. Cause of dilated calyx with white infundibulum. It is causes structure secondary to calculus. It may be due to calculus. Question number 20. 2 cm renal lesion. When defined of high signal on T1 and T2 images. Horizontal renal vein is separate from the lesion. The findings are most likely to present which AML, amyotrophic angiomyolipoma, because high on T1 and T2, so high on T1 pads and then T2 also. And renal vein is separate from the lesion, so it's angiomyolipoma most likely. Question number 13. Which causes immediate pain? If it involves the renal vein, then it is tumor. So renal vein is separate, so angiomyolipoma. It is benign. 13. Which causes immediate pain, persistent nephrogram or intravenous urogram? Renal vein thrombosis causes faint persistent nephrogram or IVU. Faint and it's persistent IVU, renal vein thrombosis. Question number 14. Which is the cause of rim nephrogram? Acute complete arterial occlusion is the cause of rim nephrogram. Question number 15. Regarding molar pregnancy ultrasound. Patients with low PI, P1 are more likely to become resistant to single drug therapy with methotrexate because it indicates AV shunting. When molar pregnancy there is low PI, then it means there is atrioventricular shunting. And when there is AV shunting, then the patient will be resistant to single drug therapy with methotrexate. They then give multiple because there is mixing of blood. Question number 16. CT shows enlarged right kidney with a large trigon calculus and hydronephrosis, most likely diagnosed with granulomatous pyelonephritis. Enlarged right kidney with a large trigon calculus and hydronephrosis. Question number 17. Non-cyanomatous germ cell tumor is diagnosed. Best answer. Right-sided tumor spread initially to aortocaval lymph node. No, and non-cyanomatous germ cell tumor. Right-sided tumor spread initially to aortocaval lymph node. This is important. Question number 18. Involvement of it indicates the poorest prognosis in recurrent endometrial cancer, spleen. 19. Which most favors a diagnosis of adult prostate sarcoma rather than adenocarcinoma, solid and cystic components? Favor diagnosis of adult prostate sarcoma rather than adenocarcinoma. Sarcoma has solid and cystic components. 20. Paratesticular space, most common benign tumor, adenocarcinoid tumor. Paratesticular space, most common benign tumor, adenocarcinoid tumor. The 21, a 3 cm on the left kidney, MRI ison test on in-phase sequence and low signal on the opposite phase sequence, mostly diagnosed AML, angiomyopathy. Because this ison test on in-phase and out-of-phase sequence, we two in lipids, so angiomyopathy. Question 22, in prostate cancer, which changes in MRI reads spectroscopy, elevated choline citrate ratio is seen in prostate cancer. Question 23, which would contraindicate buscopan injection, myasthenia gravis. 24, in dynamic renal imaging, what is true? Total divided renal function are evaluated leading to rate of transit to parenchyma and outflow tract. Dynamic renal imaging, so total divided renal function evaluated in addition to rates of transit to the parenchyma and outflow tract because it is dynamic imaging. 25, diagnosed with pulmonary arterial nodosa, which is true. It produces moth-eaten nephrogram up to the top of the microaneurysm. Pulmonary arterial nodosa. 26, new onset hypertension, MRA shows narrowing at the distal right main pulmonary artery, mostly diagnosed by muscular dysplasia. Now, muscular dysplasia is causes 35% of renal artery stenosis. So the patient had hypertension, then the narrowing at the distal right main renal artery, which is renal artery stenosis, most likely diagnosed by muscular dysplasia. 27, 3 cm cystic lesion on the CT. On CT, thickened septate with nodal area calcification, which Bosniak calcification describes lesion 3. Because 3 thickened septate and nodular calcification is seen in type 3. Type 2 is multiple thin septate, and type 1 is simple cyst. 28, T2 disease in renal cell carcinoma is tumor size is greater than 2.5 cm. Is T2 disease in renal cell carcinoma is tumor size greater than 2.5 cm. 29, regarding lymphoma of the kidneys, CT may demonstrate sheet-like diffuse infiltration of perirenal tissues. Lymphoma of kidney shows CT may demonstrate sheet-like diffuse infiltration of perirenal tissues. 30, regarding metastatic site of disease to the kidney are usually hypervascular on CT. Metastatic site of disease to the kidney are hypervascular on CT. 31, which most favors renal cell carcinoma rather than tertiary cell carcinoma, renal vein invasion. 32, concerning squamous cell carcinoma of the kidney, renal calculi are present in most patients. Squamous cell carcinoma. 30, which is the cause of cortical rather than medullary nephrocalcinosis, acute cortical necrosis. Is the cause of cortical rather than medullary nephrocalcinosis because name cortical, so acute cortical necrosis. 34, regarding hydronephrosis of pregnancy, occurs in 90% of pregnant women by third trimester, usually involves the entire length of the uterus. Then hydronephrosis of kidney, shown 34. D. Morphine dilatation disappeared postpartum. When hydronephrosis of kidney, it occurs in 90% of pregnant women by third trimester, and it disappears postpartum. 35. Which is a neoplasm affecting the breast that is least likely to contain bone cartilage or osteoid tissue? Lymphoma. Lymphoma is very simple neoplasm and it does not contain bone cartilage or osteoid tissue. 36. Regarding endometrial carcinoma MR, usually low signal, then brightly enhancing normal metrial tissue of contrast. Endometrial carcinoma on MR usually is low signal. It first low signal, then brightly enhancing normal metrial tissue of contrast. Of contrast is brightly enhancing. 37. Which ovarian masses appear more cystic in than solid endometriosis? 37. 8. Which is least likely to suggest a malignant lesion in the breast? Thin halo. We're not seeing a malignant lesion in the breast. 39. Which is the best at distinguishing fibrinoma from carcinoma? Homogeneous ego pattern is distinguished fibrinoma from a carcinoma. 40. MRI shows two separate normal-sized uteri and cervixes with the septum extending into the upper vagina. The two uteri are widely separated with perseverance of the endometrial and myometrial widths. What abnormality? Uterus diadelphys and most likely uterus diadelphys. Okay. 41. HEG shows small divertical outpouring in the isthmic portion of the right fallopian tube with distal tube occlusion. Diagnosis salpingitis Smith nodosa. Small divertical outpouring in the isthmic portion of the fallopian tube is salpingitis Smithia nodosa. 42. Regarding retroperitoneal fibrosis, in the primary form response to steroid. 43. Which is most likely to cause bilateral small rather than large kidneys? Polycystic disease most likely causes bilateral small kidneys. 44. Recurrent clear cell tumor of the ovary frequently occurs as unilocular cyst with mural nodule. Clear cell carcinoma tumor of the ovary occurs as unilocular cyst with mural nodule. 45. Recurrent mucinous ovarian tumor rupture may lead to pseudomyxoma peritonium. Mucinous ovarian tumor rupture may lead to pseudomyxoma peritonium. 46. Recurrent ovarian fibromas low on T1 and T2. Fibers are low on T1 and T2 and less or equal to myometrium. Fibers are low on T1 and T2 and less or equal to myometrium. 47. Echogenic lesion on ultrasound. Pre-contrast CT has increased attenuation 60 HU. Post-contrast lower attenuation related to the surrounding parenchyma 61 HU. Diagnosis hemorrhagic renal cyst. Look here. Lesion on ultrasound. Pre-contrast has increased 60 HU and post-contrast lower attenuation related to surrounding parenchyma 61 HU. Diagnosis hemorrhagic renal cyst. 16 and 61 show hemorrhagic renal cyst. 648. Diabetic patient presents with UTI, radiograph of small non-curvilinear lucencies outlining the bladder wall, diagnosed impericymatis cholecystitis. Hints are diabetic patients, and then there's small curvilinear lucencies outlining the bladder wall, so diagnosed impericymatis cholecystitis. Coronary MRI posterior subneural vesicles are low signal when invaded with tumor. In MRI, posterior subneural vesicles are low signal when invaded with tumor. If question 50 regarding prostate MR, volume of prostate gland greater than 60 cc precludes brachytherapy. Regarding prostate MRI, volume of prostate gland greater than 60 cc precludes brachytherapy. The next paper, parrot.